Hey y'all, it's your boy Mike. So again, just leaving work and decided to hop on to make a quick little video talking about some different things in the physical therapy world. So with physical therapy, there tends to be three different levels of caregiver, if you will. You have a rehab tech, you have a physical therapy assistant, you have a physical therapist. Now, the rehab tech is the best way I can put it is almost like the assistant to the assistant, if you will. The rehab tech is the one who's assisting with um tasks like, hey, I'm going to set up patients for this treatment or that treatment. I'm going to help push chairs along. I'm going to help push IV poles along, things of that nature. So things that don't require as much of a clinical expertise, if you will. I'm not saying that rehab techs don't have any kind of clinical expertise. They just don't have the schooling, typically speaking, towards a physical therapist assistant or a physical therapist. Some rehab techs are actually like on their way for school. For instance, when I was a rehab tech, I had clinical experience because I started off as a certified nursing assistant, and I became a rehab tech, and then I got some on-the-job training, but I was also in school to be a physical therapy assistant. So I had some clinical knowledge, obviously just not as much as the physical therapy assistant or the physical therapist. So that's like the first level or base level of the rehab world in regards to physical therapy that you can think of. The next level up would be a physical therapy assistant, which is what I am. Now, a physical therapy assistant follows the guidelines of the doctors and the physical therapist. So I pretty much so they create the game plan, I run the play, pretty much. We see the patients. We don't do any kind of evaluations, typically speaking, but we run the game plan. We see the patients. If the goal of the patient is to, or the goal of the doctor is to have the patient walk. We're the ones who's teaching the patient how to walk, how to move safely, depending on what kind of comorbidities they have, like what kind of ailments they have. There's any precautions that they have, like certain surgeries have different precautions for the patients. For instance, if a patient had what we call a CABG, a coronary artery bypass graft, so a heart surgery, the doctor usually cuts right in the sternum, right down the middle. There are certain things you're not supposed to do with your arms, because if you do, it can mess up the site and can injure the site. The site can actually heal, like misaligned, things of that nature. So what we do, as all therapists, therapists, the nurses, the doctors, we talk to the patients about the sternal precautions to help them not break those rules, so you can heal as optimally as possible. So we teach the patient how to move around safely, some of the do's and don'ts of different procedures. Work on energy conservation, so ways to get as far as you can with the energy that you have. The way I describe it to patients is, let's say that you're driving from one state to another. You're not going to get there on one tank of gas, but you have to know where those gas stations are. So let's say if your car says, I have 100 miles left on my gas tank. There's a gas station that's 50 miles away. There's a gas station that's 98 miles away. Granted, I probably could make it to the gas station that's 98 miles away, but why risk it? I'm going to take to the first gas station so I know I can make it to my journey overall. That's pretty much an example of energy conservation. So we kind of help educate the patient on that, different procedures that could happen, different ways of moving around, just different ways of getting back to your overall life. So a physical therapy assistant is, again, the second level, and that is generally an associate's degree level. So a rehab tech, sometimes it's on-the-job training, sometimes there may be a certification, but it's generally on-the-job training. A physical therapy assistant is an associate's degree. There are bachelor level degrees on physical therapy assistants. However, there's not that big of a difference, to be honest, between the bachelor's and the associate's degree. So personal preference. The next level up is the physical therapist. Now, the last time I checked, there aren't any master's level physical therapist programs out there anymore. The last one that I know of was 2008, 2010. So it's been a while. So if a physical therapist has graduated after that, more than likely they have a doctorate level degree of education. And pretty much the physical therapist is the one who goes into the patient's room. They evaluate the patient based off of the needs, the recommendations of the doctor or whatever the patient's ailments are. They evaluate the patient. They go ahead and create an overall game plan that they may follow, or they'll just send it to the therapist assistant, whoever is available, whoever has the most space on their calendar. Generally, the physical therapist can do a lot more special tests. They can do a lot more range of motion testing. They can do different manual muscle testings. They can do they have different levels of expertise that they're allowed to do that we are not allowed to do as assistants. The physical therapist, depending on the setting, they can do wound care. They can do like debridement. They can treat different acuities of patients. So sometimes they don't allow assistants to treat like NICU patients. Depends on the location, depends on the facility, but generally those will go to the physical therapist unless the assistant has a certain specialty of training. The therapist can see a lot more, those higher level of cares, the lot more traumatic patients, typically speaking, a physical therapist will see. Sometimes, again, depending on the therapy assistant, depending on the setting, depending on the situation, things like that, a therapist assistant can see those higher level of patients. So again, a physical therapist, if they've graduated typically after 2010, they more than likely have a doctorate degree level of education. The difference between, why would you choose one or the other? So let's say if you're like, hey, I'm just starting, I just want to learn some basic stuff, then you just want to, get your hands, dirty a little bit, just get your foot, dip your toe in a little bit. Rehab tech. If you're like, hey, I enjoy the physical therapy world, but I don't want to go the full route of a doctorate degree, therapy assistant. You have a little bit less autonomy. So now you're not able to do as much. You still have to report to other people, but you can still treat patients by yourself. You can kind of move around by yourself. You have your own patients that you see. You can talk directly to the doctors, to the nurses, depending on your comfort level, depending on their comfort level. Again, because every provider is a little bit different in regards to their patients on who their patients see. Doctors they care for their patients. They want to make sure that their patients are taken care of optimally. So depending on the doctor is who they can kind of talk to. As a physical therapy assistant, we can do a lot. If we see something that the patient is progressed past the plan of care that the therapist described, we can go ahead and talk to the therapist and say, hey, I've noticed this about the patient. Is it okay if we progress past this particular level? They'll say, yeah, go ahead, and no, don't do that, depending on the therapist assistant relationship, depending on the patient also. Because again, just like with exercise, there's some days you're doing amazing, some days you kind of just fall. So a therapist assistant can talk to the therapist and say, hey, I've noticed this, and this about the patient. Can we go ahead and alter this? Again, the therapist can say, yeah, go ahead and alter it. Yeah, don't go ahead and alter it. In regards to the therapist, the physical therapist, again, they pretty much call the shots in regards to the rehab world. There are different levels, so depending on where you're at, and if you go to a nursing home, they have a physical medicine and rehabilitation doctor. That's something completely different than a physical therapist. Something completely different. But again, the physical therapist, they call the shots. They go ahead and make the game plan. Again, they can alter it as need be. Again, they're the ones who do the evaluations on the patient. Which one should you choose? Which one is best for you? Just depends. All the routes are amazing. Again, I started as a rehab tech, went physical therapist assistant. I didn't go physical therapist. A couple of reasons why. But if so this is why I say if someone's like, I want to go physical therapist, if they don't have healthcare experience but they want to be a physical therapist, I say start at the bottom and work your way up. Unless you're like, I know this, then go ahead, go straight for physical therapist. It's an amazing field, don't get me wrong. However, the reason why I say work your way up is, as a rehab tech, you're getting your feet dirty. You're seeing, okay, is physical therapy what I thought it was? Is it the glitz and glamour that it shows? Are you just working with athletes, or just working with people who are semi-sick? No, as a rehab tech, you're just getting your feet dirty. with minimal financial and time investment. That's a big thing, because you can always make more money, but time, and then the debt, forget about it. So I say become a rehab tech first. After you become a rehab tech, you're like, I still want to be a physical therapist. I say become a physical therapy assistant. The reason why I say don't go straight to physical therapist, become a physical therapy assistant, is you have a little more autonomy. You can follow the game plan a little bit more. But you can also alter it slightly, on the job training, and you can save your money. So I say save your money. That way, let's say if you decide, hey, I want to be a physical therapist, you already have a stash of money saved aside, so you don't have to take out so much money on student loans. Because student loans are insane. They're insane. My physical therapist, my PTA program costs less than $13,000, whereas most physical therapy schools, if you can find a very, very, very inexpensive one, $80,000. So I'd rather someone who's interested in therapy world spend $13,000 and decide they don't like it, and an associate's degree level of time compared to a doctorate level of time and $80,000 minimum. You know what I mean? So if you're like, hey, I'm really thinking about this, then if you want to skip the rehab tech route and just go straight to physical therapy assistant, go straight to physical therapy assistant. Make sure this is a world that you like. Save up your money so you actually so you have a little cash stash. So that way, if you do decide to go physical therapist, it's like, hey, I don't have to take out as much money out for student loans because I have, I set aside however much money you're able to set aside. So it's easier for you. It's a little bit less stress on the outside, because the loans will get you. If you don't know, the loans will get you. Trust me. But again, that's just a little brief synopsis of the therapy world in regards to physical therapy. So you have rehab tech, physical therapy assistant, physical therapist. Now again, we do collaborate with other therapists. Sometimes, depending on the facility, you have like a recreational therapist, you have a music therapist, an art therapist. Almost every facility has an occupational therapist, which there are things that we can't do with physical therapy without our occupational therapist. So all my OTs, I got love for y'all. All my CODAs, certified occupational therapy assistant, I got love for y'all. So again, there are different routes of the therapy world that you can do. You can go occupational therapy assistant. You can go speech therapy. That's something completely different. It's like what they do is like, it's amazing. They can do like swallow studies and just like see how someone's actually swallowing, how they're breathing, if they're safe to eat certain foods. It's really amazing what you can do with speech therapy. That's a whole nother route. So much respect, and that's a whole nother specialty. And unfortunately, speech therapists don't get as much respect as they should. But again, the rehab world is very, very vast. But the big three, if you will, PT, OT, and speech. If there's any other questions, comments about the rehab world, like what does it entail, what I like about it, what I not like about it, drop in the comments. I love to chop it up. With y'all. But again, just finishing, my day of work. Decided to record a little video for y'all, just to kind of give you like a little brief synopsis of the therapy world. All right, later.